Many people don't realize this, but some of the most commonly used medications today can quietly damage your kidneys. Medications are powerful tools. They can save lives, reduce pain, and control chronic diseases. But they also come with risks, especially as we get older. Over time, our kidneys naturally lose efficiency. That means they become less capable of filtering waste and chemicals from the blood. As we age, health problems tend to increase, and with more conditions often comes more medication. Unfortunately, certain drugs can place extra stress on the kidneys, leading to a condition known as drug-induced nephrotoxicity. When the kidneys are injured by medications, their ability to filter blood is reduced. This can cause toxins to build up in the body and may lead to serious health complications. Kidney damage can range from mild and temporary to severe and permanent. The risk is even higher in older adults and in people who already have kidney disease. There are two main ways medications can harm your kidneys. The first is dose-dependent toxicity, where higher doses increase the level of damage. The second is idiosyncratic toxicity, which is unpredictable and varies from person to person. In some cases, avoiding certain medications altogether is the safest choice. Drug-related kidney injury can occur through several mechanisms, including muscle breakdown, kidney tissue damage, impaired kidney function, or dangerous acid buildup in the body. These problems may result in reduced kidney performance, fluid imbalances, or serious electrolyte disturbances. In this video, we'll explore how some very common medications affect your kidney health and what you can do to use them more safely. Understanding these risks can help you make smarter healthcare decisions and better protect your kidneys while treating other conditions. Before we begin, please note, all information shared here is human-produced, carefully reviewed, and fact-checked by professionals. Now, let's take a closer look at 7 common medications that can harm your kidneys. 1. Antibiotics, a common treatment that can strain your kidneys. Antibiotics are some of the most commonly used medications, but many people don't realize they can also put stress on your kidneys, especially as we get older. Doctors prescribe antibiotics to treat bacterial infections such as sore throats, skin infections, pneumonia, and urinary tract infections. These drugs work by killing bacteria or stopping their growth. Common examples include amoxicillin, ciprofloxacin, augmentin, Bactrim, and vancomycin. However, antibiotics do not work against viruses like colds or the flu. Even when taken correctly, certain antibiotics can harm the kidneys. Drugs such as aminoglycosides, polymyxins, and vancomycin are known to cause kidney injury. Because the kidneys are responsible for filtering these medications from the blood, some antibiotics can build up inside kidney cells, leading to inflammation and cell damage. Studies from the CDC and the Journal of the American Medical Association show that nearly 1/3 of antibiotics are prescribed unnecessarily, exposing many people to avoidable kidney risks. If your doctor suggests an antibiotic, ask whether it's truly needed. When antibiotics are necessary, always follow dosing instructions carefully, finish the full course, and never save or share leftover pills. Used properly, antibiotics are powerful tools, but misused, they can quietly damage your kidneys. 2. Proton pump inhibitors, often called PPIs, are widely used medications for acid reflux and heartburn. Many of them are available over the counter, which makes people assume they're completely safe. But long-term use can carry hidden risks for the kidneys. PPIs work by blocking the stomach's acid-producing enzyme, reducing symptoms of acid reflux, GERD, and stomach ulcers. Common PPIs include omeprazole, pantoprazole, esomeprazole, and lansoprazole. Although effective, PPIs have been linked to a kidney condition called acute interstitial nephritis, an inflammatory reaction inside the kidneys. What makes this especially dangerous is that it often causes few early symptoms and may go unnoticed until kidney function drops. Research has also shown that long-term PPI use is associated with a higher risk of acute kidney injury and chronic kidney disease. In addition, PPIs can lower magnesium levels in the blood, which disrupts electrolyte balance and places further strain on the kidneys. If you rely on PPIs regularly, it's important to use the lowest effective dose and avoid taking them longer than necessary. Regular checkups can help monitor kidney function and mineral levels. While PPIs can provide relief from acid-related symptoms, prolonged use may slowly compromise kidney health. 3. NSAIDs, everyday painkillers that can stress your kidneys. Non-steroidal anti-inflammatory drugs, or NSAIDs, are some of the most commonly used pain relievers in the world. Many people take them daily without a prescription, often unaware of how strongly they can affect kidney health. Common NSAIDs include ibuprofen, aspirin, naproxen, diclofenac, and celecoxib. These drugs are frequently used for headaches, joint pain, muscle injuries, arthritis, colds, and flu symptoms. NSAIDs work by blocking enzymes that produce pain and inflammation. However, those same enzymes also help protect kidney blood flow, especially during dehydration, illness, or stress. When they are blocked, blood flow to the kidneys can drop. This reduced blood flow can lead to fluid retention, higher blood pressure, and acute kidney injury, particularly in older adults or people taking high doses for long periods. In some cases, repeated NSAID use can contribute to long-term kidney damage. Studies show that NSAIDs are a common cause of medication-related kidney injury worldwide and are frequently involved in hospital admissions due to drug side effects. To reduce risk, NSAIDs should be used at the lowest effective dose and for the shortest time possible. People with kidney disease, heart problems, or dehydration should be especially cautious and consult a healthcare provider before using these medications. Number 4. Diuretics. Helpful for fluid control, risky when overused. Diuretics, often called water pills, are commonly prescribed to reduce fluid buildup and lower blood pressure. They're frequently used in people with heart disease, kidney disease, or liver problems, and many believe they are always safe for the kidneys. Common diuretics include hydrochlorothiazide, furosemide, bumetanide, spironolactone, and acetazolamide. These medications work by increasing urine production, helping the body remove excess salt and water. By lowering blood pressure, diuretics can indirectly protect the kidneys over time. However, problems can arise when doses are too high or fluid intake is too low. Excessive diuretic use can lead to dehydration, which reduces blood flow to the kidneys and increases the risk of acute kidney injury. Diuretics can also disrupt electrolyte balance, affecting levels of sodium, potassium, and magnesium, further stressing kidney function. Research shows that people taking high doses of diuretics, especially those with existing kidney disease, diabetes, or high blood pressure, face a higher risk of kidney injury. If you take diuretics, staying well hydrated and having kidney function and electrolyte levels checked regularly is essential. When used correctly, diuretics can be beneficial, but misuse can quietly harm your kidneys. Number 5. ACE inhibitors. Kidney protection with important warnings. ACE inhibitors are prescription medications commonly used to treat high blood pressure, heart disease, and certain kidney conditions. They're often considered protective for the kidneys, but they're not completely risk-free. Common ACE inhibitors include lisinopril, enalapril, ramipril, captopril, and benazepril. These drugs work by relaxing blood vessels, which lowers blood pressure and reduces strain on both the heart and the kidneys. In people with chronic kidney disease or diabetes, ACE inhibitors can lower protein loss in the urine and slow long-term kidney damage. However, Problems can occur in certain situations. When ACE inhibitors are combined with NSAIDs or diuretics, the risk of acute kidney injury increases significantly. Dehydration can also make these medications harder on the kidneys. Some people notice a drop in kidney function after starting an ACE inhibitor. In most cases, this mild change is expected and temporary. But in people with severe kidney disease, heart failure, or blocked kidney arteries, kidney function can decline too much and require dose adjustment or temporary discontinuation. For most patients, the benefits outweigh the risks, but kidney function should be monitored regularly, especially during the first weeks of treatment. 6. Antiviral drugs, essential treatments with kidney risks. Antiviral medications are used to treat serious or long-lasting viral infections such as influenza, COVID-19, hepatitis B and C, HIV, and herpes. While these drugs are often necessary, some can place significant strain on the kidneys. Unlike antibiotics, antivirals don't eliminate viruses completely. Instead, they help control viral activity, reduce symptoms, and prevent complications. Common antiviral drugs include oseltamivir, acyclovir, tenofovir, remdesivir, and interferon-based therapies. Some antivirals can harm the kidneys through direct toxicity, reduced blood flow, or crystal buildup inside the kidney tubules. This can block urine flow and damage kidney tissue, leading to acute kidney injury. Certain antiviral drugs require the kidneys to clear specific compounds from the body. In people with existing kidney disease, these substances can accumulate and increase the risk of kidney damage if doses are not adjusted properly. Because of these risks, antiviral medications must be taken exactly as prescribed and under close medical supervision. Skipping doses, self-adjusting treatment, or using antivirals without proper guidance can increase both kidney injury and drug resistance. When used carefully, antivirals can be life-saving, but improper use may seriously compromise kidney health. 7. Lithium, a powerful mood stabilizer that can damage the kidneys. Lithium is a prescription medication widely used to treat bipolar disorder and other mood conditions. For many people, it's highly effective and life-changing. However, long-term lithium use can pose serious risks to kidney health. Lithium is processed almost entirely by the kidneys. Over time, it can interfere with how the kidneys regulate water and electrolytes. One common complication is nephrogenic diabetes insipidus, a condition that causes excessive thirst and frequent urination. With prolonged use, lithium may lead to chronic kidney disease and, in rare cases, end-stage kidney failure. Early kidney damage may be reversible, but continued exposure can cause permanent injury.
Warning signs include increased urination, constant thirst, dehydration, fatigue, and electrolyte imbalances. Lithium can also cause the kidneys to lose too much sodium, which may lead to confusion, muscle problems, seizures, or even coma if levels drop suddenly. People taking lithium should maintain adequate fluid and salt intake, use the lowest effective dose, and have regular blood tests to monitor kidney function. When managed carefully, lithium can be used safely, but without proper monitoring, it can seriously harm the kidneys. Medications play an important role in treating many health conditions, but some can quietly damage your kidneys if they're used without caution. Antibiotics, painkillers, acid-reducing drugs, diuretics, heart medications, antivirals, and lithium all carry potential kidney risks, especially with long-term use. If you take any of these medications regularly, monitoring kidney function, staying well hydrated, and avoiding unnecessary drug combinations are essential. Always discuss risks and dosage adjustments with your healthcare provider. Protecting your kidneys today can prevent serious health problems in the future. If you found this video helpful, subscribe for more science-based health insights and turn on notifications so you don't miss the next one.